Welcome, everyone. We're pleased you're joining us for a talk this morning as part of ICFJ's Global Health Crisis Reporting Forum. I'm Joyce Barnathan, the president of the International Center for Journalists, and I want to thank you, journalists, for all you're doing to inform the public about COVID-19. I'm absolutely delighted to introduce Dr. Karen Kotloff, a college friend and an expert in pediatrics and infectious diseases. She's here to talk to us today about the novel coronavirus, its effect on children, and what we journalists need to know on this issue. Dr. Kotloff, as I'll call her for our interview, has more than 30 years of professional experience in the study of infectious disease epidemiology. She serves as the head of the Division of Infectious Disease and Tropical Pediatrics at the University of Maryland. She is also the Associate Director of Clinical Studies at the university's Center for Vaccine Development and Global Health. She is certified in pediatrics and pediatric infectious disease and cares for children with a wide range of infectious diseases at the University of Maryland Medical Center. She has also led numerous large studies and clinical trials to evaluate the efficacy of vaccines against a wide range of infections in the US and in developing nations. Since 2001, she's also worked in Mali and various other developing countries. She was awarded the Knight of the National Order of Mali in recognition for her work in 2005. So as you can see, we have a lot that Dr. Kotloff can talk about, from the effects on children to vaccines. So please, if you have questions for Dr. Kotloff, please type them in the chat window here on Zoom, and we'll do our best to try to answer them. I've also already incorporated questions from those of you who have sent them in. So let's begin. Dr. Kotloff, our general view is that COVID-19 affects adults much more adversely than children. Why is that?
Yes, I agree. That has been the experience so far. And to be honest, we really don't know why that is. So I can tell you some theories. One theory that I think is particularly interesting, if you see what happens in adults when they get COVID, the first week they have a respiratory illness, and that may even start to get better. And then in the second week, that's when they really fall into trouble in terms of respiratory disease. And we know that during that second week, it's their vigorous immune responses that are really triggering the pathology in their lungs. And so we wonder if there is a difference in the immune response of children to infection, so that they get the first week of some upper respiratory infection, but they don't get that explosion of inflammation that's harmful to their lungs. And whether or the level of their previous.
Dr. Kotloff, could you repeat that last part, because we lost sound from you for a minute ago.
Okay, so the last point is whether this difference in immune response to infection is related to children's previous experience and level of immunity to coronaviruses, or some other inherent difference. We really just don't know yet.
So I guess that's a big subject for study going forward.
Yes, absolutely.
I just recently read an article about that research out of China, or studies out of China, are showing that certain children handle the virus or cope with the virus better than, or older kids cope with it better than younger kids who have immune systems that are not well developed. Which children are most at risk, and why?
So I think you're talking about a recent paper that is appearing in Pediatrics. And I think you have to really look at that paper to try to understand what they're reporting. So they report that infants have more severe disease and that the severity decreases as with increasing age. But in that paper, they included children, about a third of them had proven coronavirus infection, and the rest had suspected infection, and they could have had other infections.
Right.
We really don't know from reading that if the increased severity in infants was due to coronavirus.
Yeah, so that's not a reliable enough study for us to make any conclusions.
Yes, I agree.
Have any children had lasting effects, once if they've been exposed? Has there been any danger that it's hurt their lungs in any way, since they've coped with the illness quite handily? But I wonder if there's any after effects, or do we not know that as well?
Yeah, I'm afraid there are a lot of question marks here. So what we know is that by far, most children who become infected have mild disease. And we know that about 10% will have more severe disease. But there are only a handful of children that we know about who have actually died from this infection. And so I think that we can feel assured from the information that we have so far is that children are faring well for the most part. And I think that's the wonderful part of the news. I don't think that we have enough information at this point to know what happens to the children down the line, if it puts them at increased risk. There's some thought that other viruses may be related to asthma later on, but even that for viruses that have been around for a long time, that's still debatable. So we don't know. I think that we should just focus on the fact that it's milder in children, and that's wonderful news.
That is indeed wonderful news for all of us who have children or grandchildren. This was an interesting question that came from one of our participants. Are there regional variations on the impact of COVID-19 on children? Whether are children in Italy, China, Spain, Madrid, New York City all essentially reacting the same way to the disease?
So we know from other viruses that there are regional differences, and that the immunosuppressive effects, for example, that the negative impact on the immune system of things like HIV and malnutrition have caused them to have a worse, more severe illness. We don't know whether that's the case with COVID. We haven't yet seen a lot of reports of more severe disease in people who are immunocompromised. That's not one of the major underlying illnesses. So maybe that won't be an important factor in determining the degree of illness. But to be honest, the only information that we have about children comes out of China, a little bit from Italy, and now a little bit from the US. And so we really don't know what's going to happen to children in places like Africa and Asia, where malnutrition is a big problem.
Yes, and there are quite a few questions on that. Is there a way, when we're dealing with this incredibly densely populated countries, India, for example, Nigeria, what are the best tools for controlling the virus in these type of countries where crowded communities are common? I mean, yesterday we talked to Dr. Sambaso, somebody you recommended, and he was excellent, but he did say that social distancing, in countries with dense populations is not a terribly effective way to control the virus. So what is your thoughts? What are your thoughts on this?
I think that Dr. So's points were very important. And I think what we keep learning about infections that spread person to person is that you have to take the social context and the political context into account when you're trying to stop spread. And so what works in China didn't work in Italy, probably can't be implemented in the United States. And there are very specific in Africa in particular, that's where I work the most, that need to be taken into account. So there are families in rural areas that have 200 people who share a cooking fire, who are considered households, who are in one compound and are densely, are in a very small space, even though some of that space is outdoor. And so when we talk about social isolation, that's not feasible, and that's not going to work in an environment like that. And so I think that we need to start really seriously thinking about how to approach control of this infection if we see that it's starting to spread in Africa, and to come up with policies and procedures that are applicable. And I do worry very much that a vaccine or some type of prevention on that scale will really have to be the answer in environments like that.
Yeah, makes sense. I wanted to go back to, you mentioned the susceptibility of populations with HIV virus and infectious diseases like TB, cholera, typhoid. So their question was, are children in sub-Saharan Africa more susceptible than children in affluent countries, simply because they're exposed to high levels of poverty, malnutrition? I know you addressed this before, but just to clarify.
So I think that they are probably going to be more susceptible to infection. They're just going to have heavy exposures. The hope is that those co-infections won't make their illness more severe. And we're going to have to see how that unfolds, but that's definitely something to keep an eye on.
And the follow-up to that, and I guess it's probably the same answer, is children who are in camps for internally displaced persons, such as in Nigeria. How do we ensure that they stay safe? Is it just the same answer? Basically, we have to wait for a vaccine.
You know, I think there are certain situations where you can have an impact. I worry very much about the detention compounds in this country for immigrants. I think that is could be an explosive situation, putting everybody at risk. And the same is true when you have low resource settings like refugee camps. And the best thing that you can do is put as much soap and water as possible, and to separate people as much as possible.
Let's move on to the subject of pregnancy, because there are so many women who are giving birth or pregnant, and they have lots of questions. I have one from a woman named Irene Caselli, who asks, what are the effects on pregnancy and on the first 2 years of life?
That's a very good question, and it's something that we're looking at really carefully. We know that for certain infections like flu, which is also a respiratory virus, that pregnant women are more susceptible to more severe infections. So it's been watched very carefully. It's also been watched because during SARS, there was an increased risk of bad pregnancy outcomes. And so far, what we've seen is that it doesn't seem to more severely affect the pregnant women. And in terms of outcomes of pregnancy, what happens to the baby is that there have been premature infants who have been born, but we really don't know if the risk is increased for prematurity with this infection. And it's going to take some time to tease that out. And then I think we've already hit on what happens to infants, and that there are those reports from China that maybe during the first year of life, infection is a little bit more severe than it is in older children, but still the majority of those infants will have a good outcome.
Is there anything known about COVID-19 transmission to the fetus? Asks a woman named Lena Kampf.
Yes, thank you. That's another very, very good question. And it's been looked at in a handful of pregnancies. And so far, nobody's been able to detect evidence that the mother can pass it during pregnancy to the baby. So we're very hopeful. It's going to need further studies, but so far there's no evidence that that occurs.
More good news. We can take all the good news we can get.
Absolutely.
Should pregnant women take any special precautions now?
So I think that there are limited precautions that can be very effective that they can take, and they're the same precautions that all people should take, and that is to try as best you can to isolate yourself, to wash your hands every time you feel that you've been in close contact with someone else or have been touching surfaces that the public has access to. So it's really the same precautions that are available to everybody.
There are a lot of women I know who are about to give birth, and they're quite worried about going to the hospital with the disease spreading as widely as it is now. What advice do you have for them?
So my advice would be to get the type of care that is best for delivering your child overall, and that you shouldn't alter that depending on the presence of coronavirus in the community or not. So I would not change my behavior as a result of that. I think that in this country, you know that there will be lots of precautions in place to prevent transmission and protect the woman from becoming infected at a healthcare center. And I think in developing countries, it's still safer to go to deliver from a midwife or an experienced person who can safely perform the delivery.
Yes, I know in New York now, I believe they're not letting spouses or partners in to the delivery room, which is one of the precautions that they're taking. Do you know of any other precautions that the hospitals are taking to make sure that pregnant women are not exposed to the virus?
I don't know any other precautions.
Okay. Should pregnant women who are infected breastfeed?
Yeah, so I think that also is a very good question and something that a lot of people have been considering. And so it's contextual, but overwhelmingly, it appears that the benefits of breastfeeding outweigh the potential risks. And it's recommended that if a woman knows or thinks she is infected, that she can continue to breastfeed, but just take precautions. And so if she has a mask or a way to cover her nose and mouth while she's breastfeeding, she should use that. And she should wash her hands before she touches the baby. And in countries where pumping is available, that is another alternative, but she needs to make sure that when she pumps, that her hands are clean and that her face is covered.
So breastfeed and also turn it over to somebody else if you can after?
Turn it over to somebody else if you can. That would be another option, to have another nursing mother who would be able to nurse your child.
Okay. Back to that question, I just got a question in from somebody about women in New York who are giving birth and not allowed to have their spouses or partners there. Do you think this is warranted or is it extreme?
So I don't want to go against policy without really understanding what's behind that recommendation. I think that the woman and the baby will be in touch with the spouse. And so I'm not sure if that interruption in contact is just to prevent potentially infected people from being in the healthcare setting and exposing other people in that environment, or if it's to protect the pregnant woman. Honestly, if that contact is ongoing before and after delivery, I'm not sure how that would protect the woman or the child.
I wonder if it's a way to preserve the protective equipment that people, because the spouse would need to get covered, and maybe they can't afford to give, especially if it's a C-section. Well, they can't afford to give that equipment to an extra person, but I don't know if that's the answer.
I'm not sure. In our hospital here, we do allow for children, we allow one visitor, but the New York hospitals are running short on protective equipment. And so maybe they've instituted that to preserve the equipment. But yeah. I don't know of a reason to do it to protect the mother or the child per se.
And I just want to encourage people who are listening to please send in their questions. I do have one more, Dr. Kotloff. I don't know if I call you Karen, Dr. Kotloff. Are newborns being tested for COVID-19 now?
No, they're not being tested, and pregnant women aren't being tested. Testing has been, as I'm sure you're well aware, one of the biggest impediments to answering a lot of the questions that you're asking me, because we are really restricting testing and there are extreme shortages in diagnostic tests in particular areas. There's a lot of inequity in terms of who has tests available and who doesn't. And so right now, it's not recommended to do any routine testing on any population.
Okay. I have a question about what can parents do to boost their children's immunity and give them a fighting chance should they get infected? Is there anything special that needs to be done besides a healthy diet and the typical exercise and a healthy diet?
I think that I don't think there is anything special that can be done. I think that parents of children who have any type of underlying disease should be very vigilant about keeping their child's asthma under control and their diabetes under control, and any type of underlying disease the child may have, to be especially compliant with recommendations for how to keep the child healthy, and to make a routine part of the child's life now frequent hand washing, and trying to teach children to keep their hands away from their face as much as possible.
Let me ask you a little bit about the vaccine or the many vaccines that are probably in the works. Will there be a special one for children, or will it be just a general vaccine for the population?
It will be the general vaccine for the population. I can't think of an example of a vaccine that's been shown to be safe for adults and not for children at this moment, but we don't even do testing on children until we've shown vaccines to be safe in adults. And so it takes time to get to pregnant women and children. So even though things are expedited, trials will not be done first in those two populations.
In your professional estimation, how long will it take for a vaccine? Is it 12 months, a year and a half to be ready?
I would say at least 12 to 18 months at a minimum.
At a minimum?
Yeah, depending on how things go.
Well, I have another question here. We've heard about various drug effectiveness in treating COVID-19. And what advice do you have for the use of these drugs, since many reports are either anecdotal or not yet peer-reviewed? And this obviously came from somebody from a small country whose which is not doing individual studies and more easily influenced by popular reports that this is effective or that is effective. So what is your view on what is effective, if anything, now?
There is no treatment that we know to be effective now. There are kind of systematic studies that are in place to try to, as quickly as possible, determine the effectiveness of the treatments that look good in the laboratory. So even our site, we are in the next week, we'll start a trial of remdesivir, which is a antiviral drug that looks good in the laboratory, that was tried for Ebola virus. So that trial will be started. And there are also trials of chloroquine. There is one study that was published with 42 people given chloroquine that stimulated a lot of interest in and statements about its effectiveness. But that study was only 42 people and had many weaknesses, so it's difficult to say anything about that. My recommendation would be to not to go out, particularly chloroquine, because that's available in some parts of Africa because it's used to treat malaria where the malaria parasite is still susceptible. I would not recommend that a parent go out and try to get some chloroquine and give it to their child. There's the chance that if they do it outside of a doctor's care, it's a drug that could have side effects and toxicity, and it needs to, when it is used, be given appropriately. And to keep in mind that there is no drug yet that we know to be effective, and so it should really only be given under a doctor's recommendations. And I would also give assurance to people who are in low resource settings that the Gates Foundation and many others are trying to work very quickly to conduct the same types of studies that are going on here to find safe and effective vaccines and treatments in developing country settings. And so they're not being forgotten, and we're hoping very much that these investigations will be available to them so we can know as quickly as possible what we should be doing to prevent and treat infections in that setting.
Yes, I think now, is it accurate? You know, New York right now is a hot zone, as they say, and there's supposedly a lot of testing going on for these drugs. At what point do we understand their efficacy? What does it take? It doesn't take 12 to 18 months to figure this out, does it?
No, so we're going to know about that much more quickly. So I think over the ensuing months, we will know the efficacy of remdesivir and chloroquine in well-conducted studies, and then we'll be able to make some recommendation. That's my hope.
Yeah, that's optimistic. That's good news too. So
yes.
Let me talk a little bit about parenting. What do we know about the psychological impact? I know you're not a psychiatrist, but the psychological impact of social distancing on children. How do you make sure your kids are not negatively affected by all this? And how can adults make children understand of the need of staying indoors and not meeting with their friends and not going to school? How do you, I mean, I'm sure the older kids can get it, but at some age, you know, it's hard to talk to, you know, certain kids about this effectively, and I'm wondering what your recommendations are.
I think you just need to be creative. I think actually, in a sense, parents are probably spending more time with their children than they did when they were working full time. Yeah. So I think that also is good news and a silver lining. And then I think there are very creative ways to keep children connected to their friends using social media, And I have heard of groups that get together and they play games through social media. So there's a lot of entertainment that can happen virtually. So I think keeping your child busy and active and happy can really help. And then children are sponges, and they're going to absorb the anxiety of their parents being attached to media to get constant information about what's happening. And I think that they need to talk to their children directly and put it in perspective and assure their children that their parents are doing everything to keep them safe.
Yeah, I think some parents worry about keeping their kids informed and engaged without, triggering fear and anxiety.
Right. I agree, but I think that giving children true information, not trying to change the facts. I think just giving them some simple facts that there's an infection going around, and so we want to protect our family. So we're going to stay indoors, and it's only for a limited time, and that will stop. I don't think children actually, they can go in their backyards and play. They can still go out. And so I think parents just should try to find new normal routines that their children can adapt to.
I have a question here from Shahryar from Bangladesh, who wants to know, how do you talk to teens about the coronavirus?
I think teens are actually much more of a challenge because teens think of themselves as being, not being vulnerable in any way. And I think that some of the problems that we're seeing in New York and elsewhere is that teens are continuing to congregate. And we're now seeing that infections, which are sometimes severe, in 20 to 30-year-olds are on the uptick in the U.S. in particular. And so, we need to do our best to find effective ways of messaging to teens, which is always a challenge. So I can't say that I'm an expert on how to do that, but I think they are definitely a group that needs very targeted messaging to keep them from being social. I mean, they're programmed to be social. And so we have to do our best to keep them from congregating.
Yeah, maybe we should get a teen expert here to
Yes.
really to talk about that subject, because they do seem invincible.
Yes.
And they're not, and they are carriers as well. So how we talk to them and make it stick is important. I have another question here from Mariana, who asks, is there enough evidence that shutting down schools will help stop the spread of the virus in society?
That's an excellent question. So what we know about other infections, so let's take flu, which everybody was really afraid, or is continuing to be afraid, that a flu pandemic is also a possibility within our lifetimes, because, sorry if there's extra noise here, flu has the ability that coronavirus has to have the human strains interact with animal strains and have new strains evolve that we are not immune to, and then severe illnesses. And what we know about flu is that children, especially school-age children, are a reservoir. So they can not be all that sick and be widely infected in the school, and then be a source of transmitting that back to adults in the community and elderly who are at increased risk of death. And so there's a concern that the same thing could be happening with coronavirus. We don't know if that's happening because the ways that you can discover that are not available to us yet. So for example, we learned a lot about flu in school-age children, and we could measure that adults in the community had fewer infections. But we haven't had the luxury of conducting those kinds of studies for coronavirus. And we haven't had the luxury of even determining how prevalent infections are in that age group. And so preemptively, in many settings, people have just closed down the schools and said, I don't want to wait and find out if that's going to be a problem. So there's no proof, but I think that it's a cautious and sensible approach.
Well, that was a great discussion, Dr. Kotloff. We learned a lot, and I really thank you for helping to inform journalists all around the world about the coronavirus in children and pregnant women. So this was really, really valuable. I just want to thank you so much. We're really grateful. We know you're busy during this pandemic, and you took the time to speak with us. So thank you very, very much. I also want to thank all the reporters who joined us. Thank you for your wonderful questions. And I just want to tell you to stay tuned. We have a strong lineup of health experts to speak with you. Tomorrow at noon Eastern Daylight Time, we'll have a webinar in Spanish with President Andrew Seal of the Migration Institute. And he's going to talk about how COVID-19 is affecting immigration policies, an important subject that we touched on a little bit today. And on Friday, we'll have a talk in English with Dr. Claire Standley of Georgetown University, who's going to talk about the pandemic's impact on public health systems. You can register for these events on our Facebook forum group, and please share information about our forum with your colleagues and submit questions at any time. Thank you, stay safe, and we look forward to gathering with you again soon. Thanks again, Dr. Kotloff. Very grateful to you.
Thanks to journalists who have done a terrific job keeping the community informed. Thanks very much.
Thank you. Okay. Bye, everyone.
Bye-bye.